New research suggests that government lockdowns during COVID caused far more harm than good. In the second part of our interview this week, Australian National University professor and former United Nations Assistant Secretary General Dr. Ramesh Thakur explains how Australian governments were among the world's worst performers in this regard. Dr. Thakur says Australian authorities rushed to panic and they created a fear-based mass hysteria which seriously clouded the judgment of the public, the media, politicians and health officials, and led to massive health, social and economic damage that was completely unnecessary.
Ramesh, we do hear stories though, and particularly in poorer countries. I mean, you know, from I guess from the South Asian perspective, I know from some, have Asian connection in East Asia. I heard a lot of my parents-in-law's friends in their 70s and 80s were dying, and they were, it seemed like there were a lot of elderly people dying from COVID. We had the horrible situations in the UK hospitals and the Italian hospitals and the, as I said, the Indian situation. There were people saying that in the United States the numbers were ridiculous because they weren't locking down. How much of that was hysteria? How much of that was true, do you think? And why were we getting that perception of chaos?
It was mostly hysteria. If you go to even New York at the peak of the worst time,
yeah,
there were some hospitals, for example, from the Navy hospital ship that was sent there, it was never used. The Nightingale hospitals that were set up in the UK, they were never used and they had to be dismantled. It's not unlike our camps that we created at great cost that were never in fact used. So a lot of it was hysteria. You're talking about the developing countries. I did an article for an African research institute where I said, if you take the petrol pump analogy of the meter for your fuel gauge that you're pumping into your car, if you had 3 or 4 items on a daily basis, COVID deaths, malaria deaths, TB deaths, AIDS deaths, COVID would not make the slightest impression on that. The other big killer diseases were there. And I said, what it shows is Europe has been hit, North America has been hit, South America has been hit. These were the 3 big outbreaks in the early months. Keep a watchful eye. It's not something to take lightly. And if things start to go bad, then in the meantime, prepare a surge capacity and then go into urgent crisis mode. But in the meantime, there is no need to panic. The big killer diseases are still these ones. And that remained true. It was never the number one killer disease, even in India. In April, May 2021, which is when all the horror stories came, it was not the number one killer disease, even in India.
Wow.
But because the media focused on that, using metrics and methodologies that were highly suspect. Remember how if you had tested positive for COVID within a month of coming into hospital, no matter what you died of, you had to be listed as a COVID death. But after vaccination, on the other hand, for 14 days after vaccination, officially on the record, you were still recorded as unvaccinated. So if you died of a vaccine injury, it would show up as an unvaccinated death.
I mean, this recording of every death as a COVID death just destroyed the data, as far as I was concerned. I mean, you couldn't trust any data. So how do you make decisions with terrible data?
It has had a longer-term, very bad impact, and we see that in poll after poll across the world now. People have lost trust and faith in governments, in the public health institutions, and in the media.
Definitely
and
the media.
So, again, some of us argued at the time, if you make vaccines mandatory, the long-term effect will be, it will promote cross-vaccine hesitancy. And most vaccines are extremely beneficial, particularly childhood immunization programs, especially in the developing world. And you're risking those for highly dubious results using dubious data at the moment. That's exactly what has happened.
Yes, now we'll have vaccine resistance.
Measles vaccine hesitancy is showing up.
Yeah. So, in the early days, I was hopeful of the vaccine would help. Obviously, everybody wanted a vaccine that would work and that would be helpful. But I was vehemently opposed and have always been vehemently opposed to the unethical abomination of imposing vaccination on people, mandating vaccination. And I have a very high bar for that. I don't even believe that if there's if there's a pandemic. You can ask people to go and shut down and lock themselves in their room, perhaps, but you cannot force them to inject something into their body. But we were dealing with, okay, mRNA technology had been around for a little while, but it was not applied in this manner ever before.
No. Well, let me say 3 or 4 things. Firstly, even the lockdown, the shutdowns, in effect, the governments imposed population-wide house arrests. Now, if I have not committed a crime and I'm not sick, I don't have any symptoms of sickness, then I do object to being put under house arrest. And I'd like to know why they're doing that. So I don't even accept that. With vaccines, early on, I think it would have made sense to say, we will make it available for free to everyone. We will recommend it to the elderly who are most vulnerable, and we will not mandate it for anyone.
We're speaking to Dr. Ramesh Thakur from the Australian National University and the Brownstone Institute. Ramesh, there were 3 news items that you addressed in your article in The Spectator recently. One of them, as you said, we don't know that the vaccine prevented anybody from being infected. It does not stop them from infecting other people. The one thing it was supposed to be able to do was stopping the severity of disease and the length of time of the duration of disease. Do we know any more about whether that even was achieved with the vaccine?
We do know. And again, we go back to the point about the age segregated impacts. For younger people who are healthy, the risk of dying from COVID or even the risk of serious injury or illness from COVID requiring hospitalization and ICU admission was very, very negligible. It was 1/10,000th as low as that of elderly people. On the other hand, the risk of collateral side effects that are harmful and seriously harmful is 20 to 60 times higher. So the cost-benefit ratio just doesn't work for young people. And therefore, requiring mandatory vaccination for example, university-age students, which is the one that we're talking about, just never made any sense, and yet most universities imposed it. Now, earlier this month, having last month said that for the incoming new students in the fall, in the northern fall this year, Harvard would still require vaccination. Earlier this month, they finally said, no, that will no longer be necessary. We would recommend it, but we're not going to require it. Given the position of Harvard in the world of higher education, I'm hoping that this will have a flow-on effect, and a lot of other universities will back off that. So that was the one hopeful news.
Can Harvard afford any more hits to its reputation? I don't think so. They need to get their act together on a number of fronts pretty fast. All right. The other article was Pfizer advertising to recruit children essentially as big pharma lab rats. I mean, they really did play on parents' fears and, put pressure on parents to actually get their kids. When they knew, there is evidence to suggest that they knew that they weren't 100% sure that this would even be of any benefit to children, and that the risks were, could be serious.
Well, we didn't know because they were never part of the original trials. Children and pregnant women were not part of the original trials. By definition, we didn't have any long-term safety data. And the efficacy data that you referred to earlier showed effectiveness. The relative risk reduction was in the range of 95%. The absolute risk reduction was under 1% because most people were not at risk. So the children were never part of the trial. It should never have been authorized for children. I still don't accept any justification for authorizing it for pregnant people without the long-term safety studies. This is a new technology. It may be immensely beneficial down the line. But until the long-term studies are done, we just don't know. The precautionary principle actually technically means that we should have said no until we have the data, rather than go ahead and risk it.
Yeah, or at least run a trial, right? Rather than using the actual rollout as the trial. If you like that content, there's a lot more where that came from on The Other Side, a weekly show we put together, a summary of all the news of the week to get you smart for the weekend without the woke. Join us, smash that subscribe button and support us, and the little bell, and you can watch a full long episode here or subscribe here.